Okay, right. So, what is a stroke? I did talk about a stroke some time ago. I've done two videos on a stroke, so I don't want to talk about strokes today. But I want us to remember that there are two types of stroke. There is a stroke that is ischemic, like a clot, a blood clot, and there is a stroke that is bleeding, that is bleeding into the brain. That's another form of stroke. So we have two very common types of stroke, and we have the TIA, which most people confuse and think, oh, because my symptoms have improved after 1 month, I didn't have a stroke. I had a small stroke or a mild stroke. I don't know what that is, but a stroke is a stroke. If you have symptoms of stroke more than 24 hours, you had a stroke. Stroke, that is it. Some people have really bad damage from it. Some people have really mild damage, but it is a stroke. There's nothing like, oh, I had a mini stroke. No, there is a stroke, and that's a stroke. And today, I want to talk about life after the stroke. What is my chances? I've had a stroke now. Your family member has had a stroke now, or your mother, your father has had a stroke now. What is my how can I help? Is this person going to recover? Is there any hope for this person? That is what I'm doing today, guys. That's what I want to talk about today. And it's very important for me to talk about it. Before somebody had a stroke, something had caused it. Very few numbers are unknown causes. Sometimes we don't know what caused it, but most of the time there's always either risk factors that can lead to stroke. So we have high blood pressure, diabetes, high cholesterol, lifestyle, obesity, alcohol, smoking, and irregular heart rhythm. I've done irregular heart rhythm on the Health Gospel. I did atrial fibrillation, is there on the Health Gospel page. I've done hypertension, is there on the Health Gospel page. I've done diabetes twice or three times. These are all risk factors that can lead somebody to have a stroke. So today we are going to address, now somebody has a stroke. How do I help? The first thing we need to recognize is, why did the person have a stroke? Because most people in Africa, they will have a stroke and have another stroke and have another stroke and die from it. Some die in their sleep because they've now had a massive bleed in the brain. Most people in Africa have strokes from very high blood pressure, uncontrolled diabetes. They have very high cholesterol without knowing, and they suffer a massive stroke. If I was using my other device, I would have showed you the damage that happens to the brain. So when somebody has had a stroke, there is a big damage to the brain, and the brain, it controls everything in our body. The brain is the powerhouse of the body. The brain controls our eyes, the way we see, our hands, our nose, our smell, taste. Everything is controlled up there in the brain. So when somebody has a stroke, depending on the area of the stroke, the person will have deficiencies, problems in that part of function, what that part of the brain was doing to the body. Probably the center of seeing. The person will have problem with vision. Probably the center that controls urinating or going to toilet, the person will start having problems. Probably the center that controls the nerve that goes into the hand, the legs, the person will have weakness. So we see stroke people have one-sided weakness. So the part of the brain that is affected, that used to send signals to this side of the body to move, that part is damaged. So the person will have problems like weakness and all that on one side of that body. So those are the things that you look out for. Those are the symptoms of a stroke. So one-sided weakness, the person will have problem with vision, taste, smell, urinary problems, going to the toilet, bowel problems, a lot of problems that is going on that this person will have. And without us understanding the reason why the person had a stroke, we cannot help. Most people think when you have a stroke, that's the end of the day, and they take the patient or this person straight to the church or straight to the house, and they abandon the person there. The person cannot do anything. So today I want to help people to be able to help their relation, to be able to help their partners or their family member or their husbands or their wife who has had a stroke. I want to help somebody. That is why I'm doing it. I might do it again next Saturday because today is quite sketchy. My device just packed up. I think it needs upgrading. Probably, I don't know, but it just packed up. So, what are the effects of stroke and how can I help my person? Number one, when your family member has a stroke, please, you need to sit down with the doctor and say, what do you think caused the stroke? If it is high blood pressure, when the person has recovered and is lucky to be alive after the stroke, you need to make sure that blood pressure is under control. You need to make sure that blood pressure is under control, is well managed. If it is diabetes that causes this person to have a stroke because of uncontrolled diabetes, you need to make sure that diabetes is under control. If it was high cholesterol, you need to ask the doctors what caused this thing, and there are few things that is important after a stroke that somebody should be on. Somebody has to be on a cholesterol tablet. The patient has to be on antiplatelets, something to thin the blood that to prevent this person having another stroke. The person has to recognize, or the family or the doctor, especially in Africa, I'm not talking here in the UK or in Europe because they know exactly what to do. The only aspect that will affect us here is the aspect of home rehabilitation, which I'll be talking about. So when this person has a stroke, please, I've had issues with people when they had a stroke. I have a friend, she was in my former school, and the mother had a stroke, and I was asking the medication. She had very high blood pressure and she wasn't controlled even after the stroke. She wasn't given a cholesterol tablet, she wasn't given antiplatelets. So all this medication she wasn't given, and it's very important for the person to have them, but she wasn't given. So I said to the doctor, you need to go and sit with the doctor and let them know exactly medications to give your mother, because one, her blood pressure is still very high. We need to control it. If not, she's risk of having another stroke. So these are very important to find out, why did my person have a stroke, and make sure that the cause of that stroke is well controlled, that you're controlling it, right? If it is blood pressure, make sure that the person's blood pressure is under control, because that person is at a higher risk of developing or having another stroke. Make sure that the person's blood pressure is well controlled after the stroke. If that person was hypertensive, make sure that the person's blood pressure is well controlled. That is a primary thing you can do for your family member. That is the most important thing. If the person was diabetic, make sure that you are no more going to make mistakes, that this person's diabetes will be under control. So if the person had high cholesterol, and these are tablets that are given to stroke patients, they must have to be on those medications. It's very important. Effect of stroke is kind of muscle weakness, so the part of the body is weak. And I noticed that when somebody have a stroke in Africa, the first few weeks, days to weeks, is very crucial, very important. This person need to start having therapy. Some people will say, I don't know, I don't have money to do therapy, but movement is very important. Movement is very important. Even if you don't have money for physiotherapy, this person should not be bedridden. This person should not be confined to a bed. This person should be taught to start doing stuff little by little. I had videos to show, but I'm not using my device that I normally use. I would have showed the video of a completely paralyzed man who is now running marathon because he has bit by bit train himself to be able to start using the functions that were lost during stroke. So please do not confine your person to the bed and say he has a stroke. He just lies there. It's the most dangerous thing to do. This person has to start moving. This person has to start doing small, just something small every day, like trying to touch a cup, like trying to touch a pencil, like trying to hold onto an object. He can do that for 1 week, just trying to use that side that is weak to hold on to something. That is the goal for the week. I just want to hold, not to carry, not to lift. I just want to hold this cup. So the person every day, that exercise is training the brain that is not damaged by stroke to start functioning. That concentration helps the brain to start compensating for the side that was damaged by stroke. So your relative needs to have something doing. So you are saying today you need to roll this ball. You might not be able to do it, but that concentration is giving the brain that signal to compensate for the side that was damaged. So the person will have to start doing little things, maybe holding a ball, maybe looking at objects, trying to point things. These are things that are specialized in developed countries. We have occupational therapists, we have physiotherapists, we have orthodontists, we have speech and language therapists. They help the people with speech, they help them with language. So physically, the person will have weakness in the muscle, the person will have maybe really spasticity, very tightened muscle, it cannot bend the hand. These are things that you need to help through physiotherapy. If you don't have money for physiotherapy, I know what it entails to have a physiotherapy in Nigeria. I've been opportune to speak to somebody who we needed physiotherapy for. They are very expensive. But I said to the person, you can see what the physiotherapy did the first session, the second session. If you don't have more money, you can just help your family to do it the way the person did it. It's important for the patient to start moving, to start using that part of the body that was damaged by stroke. So just concentrating on an object, trying to pick it up. You might not be able to pick it up, maybe a pencil, maybe a pen. Every day he wakes up, he tries to lift something, he tries to touch something. You are helping the person's brain to rejuvenate, to compensate for the side that was damaged. Now, this is weakness, so that is very important. Please do not leave your patient, your family member on the bed. You say he's bedridden. She's bedridden. There's nothing like bedridden. Help the person to get up. You can use pillow to help them to sit up. You can help them to sit up. Use pillow, guide them. Small, little by little. It's not a massive thing every day, but something little. But don't allow the person to lie down. You people say bedridden. There's nothing like bedridden, except you have allowed the person to lie on the bed for a long time. It will be very difficult for the person to come back. So if your patient or your family has a stroke, a family member has a stroke, please advise them to start moving that person. Start moving the person. Not lift the person to stand when they have weakness. No. Little things. Very little things. Like holding a pen, like trying to concentrate on a picture. Show them family pictures, show them objects that are interesting, write and let them just have a look. If it's an old woman, try to sit them up, try to engage them. That little thing they are doing is helping to the brain to compensate to the side that was damaged. Because physiotherapy, speech and all this specialized therapy, we don't have it in Nigeria. We have it, but it's expensive. People cannot access it. So you can help your family member. This is the essence of this talk today. Sit them up, help them, a little thing every day, something very little, like try and hold this cup, or small pebbles or small balls. You give them to try and hold. They'll try to hold the ball. They cannot. Tomorrow they try again. Maybe 30-minute session, 10-minute session every day. It will help the person to do what? Compensate. The person will start using the nerves, which are the tiny signals that go to the muscles to help the muscle move. The brain will start compensating and sending more compensatory mechanism to that side of the body that needs, that you are helping your patient, your family to use. Maybe he has lost half side of the body. You keep a little ball on the floor for the person to be rolling. He can't do it the first day. Tell the person, you encourage them to help to roll. Just look, or give them a pencil to hold. Tomorrow you give them something a little bit bigger. These are the ways to help your person. Don't allow them to say they are bedridden. There's nothing like that. Because this person cannot move, they can have problem with incontinence, urine incontinence. They cannot go to the toilet because they can't walk. Some of them are embarrassed to tell you, so they wet the bed. Some of them, because of the stroke, they don't have that feeling that they want to urinate or they want to go to the toilet, so they wet the bed. They can wet the bed, or they can poo on the bed. These ones are serious. You need to give them continent part. These things are things that are still taboo in my country. Continent parts are not taboo. You want to help your patient, your family member. Don't leave them bedridden because they say it is their sins that have caught up with them. They need help in terms of support. We need to support them. Number 2, which is very important, I should have mentioned it number 1, is nutrition. When somebody has a stroke, most of them have problem with swallowing. So the normal things they used to eat, they might not be able to eat it anymore. Some of them have problem with a test. They cannot taste food. So because they cannot taste food, they don't have, they are not interested. They think it doesn't taste nice. They can't taste it because that sensation that was the brain's function, that function of the brain has been damaged. They cannot taste food. They cannot swallow because the reflex, the complex mechanism of swallow has been damaged by the stroke. So they cannot swallow. You see, most of them, you give them water and it dribbles down the mouth. They can't swallow it. Or you give them food, they choke on it, they cough on it. These are things you need to come down and be able to recognize. Is this person needing to have semi-solid food or mashed food? So instead of making that hard eba, you give them soft, nice eba, or give them thickened something like thickened soup. And give them with but little food at a time. Nutrition is very important in people that have stroke. Nutrition is one of the things that will kill the person. If you are not feeding this family member well, it is one of the things that will kill the person. Nutrition. If the person is not feeding well, the person might not survive the next infection. And if this person, you're giving them food, they cannot swallow, it can go the wrong way and into the lungs. The lungs is the part of our body that we use to breathe. If this food goes to the wrong part of the body, the person will develop really bad infections and would die from it. So the person didn't die from stroke, he died from after stroke management. You are unable to manage your family member at home because you don't know. So feeding is very important. If you have somebody with a stroke, you need to find out, is the person eating? If it's not eating, that means probably it cannot swallow the food. You need to then find ways to see what is best for my mother, my father, or my sibling. Should I give them mashed food? You mash like yam, you can mash it. Plantain, you can mash it. Just make it into mash and pour a stew or something. Just that type of diet. Fluid, they need to drink. They need to keep hydrated. So these are things that will allow this person to begin to recover properly. Continent, we've talked about. Continent is very important. The person becoming continent of urine or incontinent of poo. If it is your mother, your father, that is not the time for somebody to tell you that because they were witches and wizards. No, you need to help them. If you don't have money for continent pad, you can what do you call it? Improvise. You can get something to help them. They will help themselves, compensating with the side of the body that is still good. So you can get them pad, or you can help them to keep a bowel by their side. They can use it to wee when they feel, or if they don't feel, they need the incontinent pad. That's very important. And we talk about pain. Most of them are in lots of pain. Most of these people with stroke, they have lots of pain. The pain comes from the disconnection between the brain and our spinal cord. The spinal cord is that long thing at your back, that middle of your back. That's your spinal cord. That disconnection can cause what we call central neuropathic pain. The pain that they can't understand, but is there. Very severe pain. This is the time to just support them. This pain, we don't know how to. People have used different things, but it doesn't work. The pain is severe. This is a time to help your family member. Do not push them away. Do not be tired. It's a long process, and if you put yourself in it, they can recover a little bit of function to help themselves. They can recover a little bit of function. They can live longer. They don't have to be bedridden. This is why I'm doing this topic today. They have a lot of pain. You need to help them. Some of them have visual problems. They cannot see side of the side that was affected by the stroke. They cannot see from there. So what you do as a family member is try to do things to the side that she cannot see or he cannot see. Try to stand on that side. Try to speak to him or her on that side. Try to always use that side that the person cannot see. Why do you do that? You are helping the person to compensate. The person will begin to see, because he's using that side more. The brain is a very wonderful organ. It will begin to compensate, to readjust itself so that this person can start using that side to see. It's amazing to see these things work, because some people back home, especially in Africa, we just silence them. We just conclude that they are bedridden. These people are not bedridden. They just have a damage, and with working with them, that damage can be recovered by working with them. And the last thing I want to talk about is nutrition again. Do not abandon them. You just give them food, gari and soup, eba, amala, the way they used to eat it. They might not like it. You need to find out what they like now, how you can help them, how you can feed them so that they can live. It's not because somebody has a stroke, the person has to die. The death they are dying is not the stroke that is killing them. It's because we don't know what to do with them. They have become our burden. And the very funny thing is, after a stroke, somebody has left-sided weakness, they say, or gone unconscious. That is the period the person should have gone to the hospital. But my people use that period to roam about. They use that period to roam about from one prayer house to another prayer house, to the church, to healing, to this. That initial period of stroke is very important. That first few hours to days to weeks is very important, that this person should be exercised. Somebody should help them not to lie down and sulk, lie down and feel disappointed. Everything is gone. What is left for me? This is the time to motivate. This is the time to say, look, you are not lying down. You have to start doing small something, a little bit by bit. Don't give them too much to do. Mama, today you see this ball, I want you to find a way to be holding it. So mama will start to just go around the ball. Mama will start concentrating, going around carrying that ball. That thing alone you're doing two things. You're retraining mama to use the hand. You are also helping the brain to compensate, to start working, to help to that side of the body. Do not leave the person on the bedridden. Do not. This person needs to start moving immediately. This is not the time to roam about carrying your stroke mother or father. Already they are so stressed. You carry them to different places. They will make their condition worse. This is the time for you to help them to recover. The first thing I mentioned here is what caused the stroke. If it is blood pressure, please, we need to make sure that mama, papa, my brother, my sister, the blood pressure remains controlled, because this person that has had a stroke is at risk of a further stroke unless we know what caused the stroke. If it was irregular rhythm, these are things that are going to be diagnosed in the hospital, not in the healing home, not in the prophet's house. These things are not spiritual things. They are not given to your mother. It wasn't sent to her by force, by air force. It is something that caused it. Maybe high blood pressure, maybe diabetes, maybe irregular heart rhythm, maybe high cholesterol, maybe you're a smoker, you smoke a lot, your vessels are weak, they bleed. Maybe you're an alcoholic, you damage your body, you get a stroke. So this period after stroke is when you need to help the person to start active using that part of the body that was damaged. Small by small, little by little. Don't give them massive work. Little things matter. Mama, papa, today, see that pencil, try and be holding it. They concentrate, they hold it. They concentrate, they hold it. Now, the person that has stroke maybe used to be very, very active. Maybe had a job. Maybe was a very active person. Now they have a stroke. They are completely conditioned. They find themselves not able to walk, not able to speak, not able to move their body. What do you think will happen to them? They become depressed. They become very depressed. This is not the time to go and be being nasty to them again. This is the time to encourage them. You see this situation. I had a video I wanted to show of this man that attempted suicide. He actually jumped into the deep of the swimming pool. It was the girlfriend that came on time to save him. He had a stroke. He saw himself in a wheelchair. He saw himself like, what is this? This is not me. I used to work. I used to go to work. I used to earn a living. How can I sit like this? So when everybody left the house, he just pushed his wheelchair and went and drowned. But he didn't die. Now he's running. Now he's jumping. Now he's married. He's got children because he now started having therapy. These things are not available, but you can make them available. You can be the physio. You can help because the professionals are expensive. You have to pay for everything. Most people cannot afford it, but you can help your family member. You can be that person to help. So, Mama, you see this ball, you need to start holding it. in that hand that was weak, or you see this pencil, you need to start holding it. You use that for a week, then you change it to something else. Maybe moving the leg, swinging it. They will start swinging it. Little things that will help to move the body. The time after stroke is not a time to carry the woman. The man doesn't even know what is happening around her or him. You now carry mama from one place to another, from TB Joshua to Chris Oyakilome, different parts of the country. You take them on a taxi, night bus. All those things will compound issues. They will make the person to die. The stroke did not kill her. You cannot come and kill her by yourself. The stroke has left her alive. Many people die when they have a stroke. A massive bleed in the brain, they die. But your family member survived. It's a time for you to help them, rehabilitate them. If you have the money, immediately she has a stroke, pay a physiotherapist. Pay a physiotherapist. That is the best gift you can give to her or him. Pay a physiotherapist, speech and language therapist. If you have the money, pay. If you don't, you can help. You can be the help. You speak to your mother. You show her pictures. You talk to her. If you're working, you are very busy, but maybe once in the weekend, if you're around her, you can help. If you're living abroad and your family member has a stroke back home, you can send support like this type of talk to the family members around her to help. Sit her up. The lying down bedridden is going to kill them. Because if they have infection, they cannot fight it. Remember, they are not even eating well. Remember, they are not feeding well. Remember, you are not giving them food. You give them food, money, they buy the food that they think she used to eat before. They prepare, they keep for her. Mama is not eating, they carry it away. They come in the afternoon, they keep the food. Mama is not eating, they carry it away. She is lacking nutrition. You need to then modify. You need to then think about how to help. You need to think about what to do, how to change these things, make it mash, make it soft, make it interesting so that she can eat. Nutrition is very important. They can go into depression. About 80% of them, they go into depression. Weakness, they see the state of their body, they are depressed. You need to help them. You need to help them. They didn't bring it upon themselves. It is the situation, the stroke. They can't understand it. If you are active now, you are just sitting. If you have money, you can get a wheelchair. It's very important. She dresses up every morning. You put her on the wheelchair. You roll her outside. She looks around the environment. If she's in the village, she looks around people passing. She looks at the trees. This is not the time to put her in a room and lock the door because she has a stroke or he has a stroke. He can't even call out for anybody to help because the speech is lost. So you need to help her or him. You get a wheelchair or get a chair. You people can help transfer her to a chair and sit her outside few hours. Take her back in. That is therapy. That is therapeutic. It's helping her. She's looking at things. Don't confine her to a room. Some of them have a stroke that affect the part of the brain that they cannot speak. So they are listening to you. They are hearing what you're saying, but they cannot answer you, and it's very frustrating. Some of them can speak, but they speak completely nonsense. So you are asking them, Mama, how are you? Yesterday, your brother came and he brought this. Mama, did you eat today? That's what I was saying. So he came and he didn't. They will not answer you correctly. Some of them cannot speak. They are hearing you. They understand you. They can't even call your name. Maybe like Mercy, they'll say, it's frustrating. I've seen a lot of them. They'll say, they start beating, they get angry because they know what to say, but they can't say it. So what do? You support them. Say, Mama, don't worry. Don't say, just, it's okay. You support them. You start teaching them mercy. You say mercy. You teach them like ID. You say these are little things. You can help them. Little things. And this is what matters after stroke. Those little things, they matter. They kill them. Depression, they just die. Some of them commit suicide. You didn't even know. They went to bed, they did something, they took poison. You didn't know. Because their life, they feel is useless. But if you're showing them love and you're showing them attention and you're helping them, she sees or he sees that you're supporting them, they wouldn't do it. They will think about you, how you will feel. But if everybody's abandoning them onto the wheelchair and to the bed, they say, my mother is bedridden. Why? She had a stroke. My father is bedridden. They are bedridden. Please, today, my point is, even if it's for one person and you have a family member who has a stroke, do not leave them on the bed. Help them, lift them, exercise, little things. Help them to get out of the bed. Sit them out. Few hours a day, 1-2 hours, okay. Give them little tasks to do. It helps with the brain compensation. It helps the brain cells to wake up. Give them little things to do. Feed them and help them. That was my talk today, and I thank God I've done it. So if you had somebody or you have that has a stroke, number one, what caused the stroke? High blood pressure, well controlled. Diabetes, control. Everything has to be controlled. And if you're a smoker, stop smoking, can lead to stroke. If you want to have the video of the stroke, if you write it here, I'll send it to you. I've done a stroke before, so I will not be dwelling on stroke. I'm dwelling on after the stroke, what next? If you are diabetic and you need the video on diabetes, ask me, I'll send it to you. If you're a smoker, I'm going to do teaching on alcohol and smoking and the effect on the body. And I will do it one of these days. Alcohol and smoking, the effect on our body. If you have high cholesterol, you need to find ways to bring it down. And if your parent or family member has a stroke, please listen to this teaching again, or ask me, inbox me, what did you say, what can I do, and I'll give you more resources to help you. Thank you so much, everybody. That was my talk for today, and thank God I did it. Thank you everyone for having the patience with me. My device just sort of packed up. I don't know what happened. It's never happened like that before, but thank you for waiting and joining, and have a blessed day. Bye.